Welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of KevinMD. Rate and review the show at kevinmd.com/rate. Subscribe at kevinmd.com/follow. Today in the show, we have Alfred and Blair Sadler. Alfred is a physician, Blair is an attorney, and together they are authors of the book, Pluck, Lessons We Learned for Improving Healthcare and the World. They have an excerpt from that book on KevinMD titled, Medical Advances Can Often Stir Up Ethical Issues. I'm going to ask each of you just to briefly share your story and journey to where you are today. Alfred, why don't you go first?
We decided when we were in Philadelphia, me finishing up my surgical residency internship and Blair is law school and a subsequent clerkship, we got in touch with each other a lot and talked about health law problems, one of which was the Good Samaritan question about stopping at the scene of an accident. And one thing led to another, and we were fortunate enough to end up at the National Institutes of Health in July of 1967 with the help of Dr. Luther Terry, who had left his position as Surgeon General and become Vice President for Health Affairs at Penn. And we submitted a list of medical legal subjects from the use of human beings in research to the definition of death, to genetic engineering, to death and dying kinds of issues to him. And he thought it would be very good to have a lawyer in the public health service, which had never happened before. So we went to the NIH as a medical legal team to address whatever they wanted us to choose. And the first thing they asked us to look at in the NIH director's office was this question of getting human tissue, in this case pituitary glands, to get human growth hormone from cadavers. And there were some legal issues related there too, which if we had a longer time, we could go into. It's a fascinating story. One thing led to another. 5 months after we were there and researching all the laws in the states relating to dead bodies, of which there are basically 4 groups, Christian Bernard did his first human heart transplant in Cape Town, South Africa. That was December of '67. And all of a sudden, this niche little area of ours, front page news every day. And Christian Bernard, for example, became Man of the Year by Time magazine. The ethical issues related to the law that we helped write, because we worked with a group called the National Conference of Commissioners on Uniform State Laws, now called the Uniform Law Commission. So it's not quite so many words to deal with. They write model state laws every year, 1 or 2 or 3, where the Constitution says this is an area of state law, but thoughtful people starting in 1892 was the first time they got into this business, would benefit by having all state laws be the same, so that whether it's interstate commerce or in this case, organ transplantation. So the law we came up with the Commissioners on Uniform State Laws in 1968, July of 1968, was the Uniform Anatomical Gift Act. And that's still in place today with some minor modifications. That was adopted in all states plus the District of Columbia in 3 years, which none of their laws has ever done. And I think the reason it went so quickly related very much to your question of ethical issues. We felt that this should be a donation statute where we as individual citizens have the right to donate if we want to. And then if we don't make a statement, our next of kin can make a statement. Yes, Fred wanted to donate his organs, and the specified order of priority in that law. And other important issues separate the transplant team of physicians from the recipient team of physicians, and therefore avoid conflict of interest. The other approach was, let's make everybody an organ donor. It's called opting out or presumed consent, unless you object. So it was the obligation was on me or you as a citizen to object. And we felt that that was not in consonance with the United States principles of autonomy and altruism and trust were the 3 key things that we went. So we're very involved in bioethics from the very beginning as we related to this issue and several others. We were involved in the human experimentation issues. And then we discovered a year later in 1969 that there was a group of people meeting in New York who were setting up something that was later called the Hastings Center, the Hastings Institute on Bioethics.
Mm-hmm.
And we went up and met with them and were 2 of the 17 founding fellows of this group. The whole point was to do an analysis of bioethical issues. Henry Beecher's article had come out in 1966 about some questionable practices relating to government-supported research. Were the normal volunteers being told effectively of the risks? And then in 1972, of course, the Tuskegee experiment hit the press, and that has been a stain on our ethics in research. There have been others, but that's been the most important.
And Blair, just briefly share your story. And I know Alfred talked about some of the ethical issues when it comes to advances, but maybe share some of the other ethical issues that's also come up famously from medical advances.
Yeah, I think what we took a big bungee jump as Fred described, at age 26, could a medical legal team make a difference? And we were very lucky that the opportunity that Fred described had such far-reaching impact beyond what even the people who ask us to look into it, because it really got to the core of individual autonomy and helping others. As we also moved from the transplant world to health workforce and the shortage, which you know well, you talk about on other aspects of other shows, the shortage of doctors and nurses, and looking at the fact that well-trained medical corpsmen coming from Vietnam, when they came back to the US, had no place to work or to be helpful. So we were very involved in the pioneering physician assistant movement, which started at Duke and in Colorado and in the state of Washington. And when we were at Yale, created the 4th physician assistant program in the country. Some of the ethical questions were, how do we assure that this newly minted person called a physician assistant is really well trained, that they are going to do more help than harm? How do they get credentialed? How do we license them at the state level? How independent can they practice? So the concept of interdependence and working as teams, which you know well as an internist is invaluable, was central to the emergence of, again, changes to state laws, because as you know well, the licensing of health practitioners are at the state licensure level, besides the national accreditation of programs and certification of individuals. So what was the way to do that? And working with a couple of other colleagues at Duke, came up with a straightforward, simple amendment to the existing Medical Practice Act, Physician Practice Act, that applies to you in New Hampshire or in New Jersey, wherever, to simply give authority for physicians to delegate tasks to nurses, nurses assistants, physician assistants, as long as the physician was ultimately responsible and accountable. So, and just in a very different universe from organ donation, the importance of looking at how can the law be a facilitator and a helper to make things move more quickly, to make healthcare better. When we got into emergency medical care, because of this opportunity to go to Yale and work with Dr. Jack Cole, who'd gotten a major grant from the Commonwealth Fund to study how do we make the emergency medical care system better, it was really quite shocking. And someone your age probably say, you know, there was a time we had no 911. Yeah, so let's take you back to 1970. No single number, no 911. Ambulances were basically hearses or station wagons. There was no EMT. I'll say that again. There was no EMT, no paramedics. There wasn't a residency or a specialty in emergency medicine, believe it or not. And so as we got to meet pioneers in other cities who were experimenting with how to increase the capability of non-physicians, this really then took off. And when we moved to the Robert Wood Johnson Foundation, as it was just getting started as a national foundation in Princeton, of the first national program that Robert Wood Johnson ever did was a program for emergency medical communications to train EMTs, train paramedics, encourage single-digit 911 numbers, train the dispatchers who knew how to handle a fire or police emergency but didn't know how to deal with the poisoning of a child, for example, and make those universal. So that was 44 grants, 32 states, and that helped teach us another thing about how do you take ideas to scale from a pilot to an idea in one place in Connecticut to the whole country. So since then, I've been very involved with healthcare leadership as a president and CEO of the nonprofit Rady Children's Hospital here in San Diego, where I live, which I did for 26 years. And a lot of what comes through in the book are the lessons we learned, those 15 lessons we learned to make a difference, which is what the subtitle of the book is about, and we think are very relevant today. People might ask, in this polarized world where civility seems to have disappeared, are these lessons valuable today? We believe they are, about finding and developing your voice, just as you have as a facilitator and communicator so effectively. Where can I make a difference? Finding one thing. I mean, I'm struck by the pediatrician Mona Hanna-Attisha in Flint, Michigan, who 4 or 5 years ago, with the lead water crisis, not only was taking care of kids who were affected and poisoned, if you will, but became a real advocate to change the entire legal system. So those are the kinds of inspiring stories we try to weave in the concluding chapter of the book, where anyone can find where they want to be, make a difference for one person, one family, one hospital. And you can lead, as we say in one of our lessons, you can lead from any chair. You don't have to be the director of the hospital or chairman of the department. You can make a difference at your own level in any way you want.
So your book is titled Pluck, Lessons We Learned for Improving Healthcare and the World. Alfred, I have an audience of mainly clinicians, and I'm going to ask both of you the same question. So from your book, Alfred, what would you say is the top lesson that you want readers, specifically clinician readers, to come away with after reading your book?
It's just picking very much up on what Blair was saying, and to digress for a moment on the word pluck and why we picked that as the title, is that one of our editors came up with it and we just went with it, because having pluck or gumption or chutzpah or courage, whatever synonym you want to use, is essential, because as Congressman John Lewis said, we can't just believe in democracy, we have to take action to make something happen. Our quote in the beginning of the book about Teddy Roosevelt saying that it's the man in the arena that makes the difference, not the critic on the side. So having pluck means picking out an area, as Blair suggested, and then maybe asking for help, asking for a mentor, asking for a colleague. Don't just jump in, but once you decide, pick one area, and it can be as simple as helping your next door neighbor who's had a stroke. It can be that basic, and that is, for that person, life-saving or life-helping. Or it can be taking on a broader issue. It can be joining a big organization relating to climate change, for example. So, or Planned Parenthood. There are lots of ways you can use that pluck. And then the other thing we like about the word pluck is, and that's why we put the P in parenthesis, that's the going action letter of the word, but the rest of it often is lucky. So when we got to NIH, for example, and got involved in dead bodies and what parts can be used for what, the fact that the heart transplant came along 5 months later took our issue we were working on to a worldwide level. And we actually became spokesmen for HEW all around the world because we had done our homework.
All right, Blair, same question to you. to my clinician readers who read your book, what's the top lesson do you want them to come away with?
I think to pick something you really care about where you want to make a difference, in addition to your day-to-day clinical practice. So what is the issue? What is the topic? And how can you make a difference? That can be as a leader, a collaborator, facilitator, an advocate, but pick something that can make a difference that gives you satisfaction. Clinical practice is demanding, it can be demoralizing, it can be discouraging. Beyond individual patient care, what's an area that you can make a difference? And then go for it. Take action.
All right. And I'm going to ask both of you just take home message, especially in current day. I know that you have a lot of historical context in terms of what you've seen, and drawing from your decades long experience, each of you, can you apply some of those lessons to a current situation today? And perhaps let's end it off with a take home message. So Alfred, I'm going to ask you that. So any historical lessons that can be applied today?
Well, I think we can look all around us and see with the pandemic, which none of us had ever experienced before, that there are lots of ways we could help out in the pandemic. If the vaccine issue comes up, how to wear masks, when to stop, a lot of these issues then became very political, which we didn't have to deal with so much, although going through our 67 to 76 period, there was the Vietnam War, there were the assassinations of Martin Luther King and Bobby Kennedy, there was the Richard Nixon presidency to deal with. So there were some tumultuous times. But I think today, picking out something related to the pandemic and COVID, and it's raising its ugly head yet again out here. I don't know what it's doing in New Hampshire per se, but we thought we were finally coming to the end of that. And so I would say picking out what role one could do relating to this COVID. I'm very involved in a PA program right now. We had to change our whole education system, as all medical and nursing schools and PA schools have done, to online, to simulations, lots of change to go with that flow and modify people's job descriptions. So lots of possibilities right under our nose.
All right, Blair, last question to you. Historical lessons that you could draw from your experience that could be applied in today's world.
I think two. One would be grow and develop your voice. Find out where can you be a most effective advocate and instrument of change. And that takes confidence, that takes knowledge, takes practice, that making a difference. So developing and growing your voice, really important. That can be in writing, that can be in speaking, that can be one person at a time, or it could be 1,000 people. The last one, I guess, we close with, which I think is very important as a state of mind, which is dwell in possibility, live in possibilities, look for opportunities to improve, and not get discouraged by the challenges all around us and the divisiveness that we're dealing with.
The book is called Pluck, Lessons We Learned for Improving Healthcare in the World. We've been talking with Alfred and Blair Sadler. Thank you both so much for being on the show and sharing your time and insight.